Hello, everybody. This is Ghassan Abou-Alfa from Memorial Sloan Kettering Cancer Center, New York. I'm delighted to present to you our new phase 1 study of AGEN1181 and Balstilimab in patients with Fibrolamellar carcinoma. You might recall last year we presented data on the combination of what's called immunotherapy, specifically what's called a checkpoint inhibitor. The drug name is pembrolizumab, and with it we had a combination with a targeted therapy called nerantinib. What's important here to note is that, yes, we had a response. As you can see from where the orange arrows is, the tumor did definitely shrink. We're very excited about this. We wanted to, of course, replicate that effort. But to be fair, we wanted to even do more than this and achieve better responses and more persistent responses and more presence of responses. For that, I'll take you back a little bit to what exactly is going on in our body. The cancer kind of like make an agreement with our immune system saying, you know what, we're friends, don't bug us, we don't bug you. So immune cells, which are like your immune cells coming from your lymph node, will try to touch onto the cancer cells, as you can see at point number 7. But the cancer, in its kindness, give a chair, the immune cells sit on that chair, they never can touch the surface of the immune cells. All what this pembrolizumab or any other anti-PD-1 or checkpoint inhibitor of that category will do, kick out that chair so the immune cell will fall onto the cancer to cause its effect to fight that cancer. We now learned and we discovered in many diseases, among which, of course, in fibrolamellar carcinoma as well, is that to make this happen, you need some kind of chain of command phone call from upstairs in the chain of command. Where is it? In the lymph node. You can see at point number 3 that the reservoir lymph node is, and this is really where the message should be sent to the cell membrane surface or the cancer cell membrane surface with the anti-PD-1 ready to do this job to make them do the job. How does this happen? There's a molecule called CD28 in our lymph node, convince CD80 and CD86, two other molecules important in the immune system, to kind of like they drink together like some potent coffee, and they can really cause a message sent down all the way to the cell membrane level to make the anti-PD-1 do its job. Interestingly, CTLA4 kind of convince CD86 to work together and play together. They go and drink maybe some heavy alcohol, they all fall asleep and nothing happens. This is where anti-CTLA4, like AGEN1181, come into play, pull away the CTLA4, let CD80 and D86 do their job. By the way, this is why I understand it, and this I would like to relate to you. This was the Nobel Prize in 2019 based on work that was done here at Sloan Kettering in New York. As such, this study is a combination of the two drugs. We have the AGEN1181 anti-CTLA4, and with it, the Balstilimab, which will be combined to really study their effect in patients with fibrolamellar carcinoma. Good news, the first part you can see to the extreme left, which is in the blue, the one in the middle in regard to the green, are almost either fully done, like the first stage, which is to the extreme left, or the middle one almost done. But now we are actually fixating on the one in gray to the extreme right, which is cohort number 6, where we give a fixed dose of the AGEN1181, which is 150 milligram every 6 weeks. Wow, getting therapy only every 6 weeks once. With it, the Balstilimab, or it's also called AGEN2034, which will be given every 3 weeks. To make it more simple, this is exactly what will happen. AGEN1181 and Balstilimab will be given on day 1. On day 22 or 3 weeks later, you get only 1 dose on Balstilimab. 6 weeks later, we're done. We will do imaging. We'll see where things are. If things are great, we'll continue on the same. We'll repeat another cycle and another cycle and another cycle. And of course, this is nice to know if things are not going well very early in the game, to make sure to give an opportunity for our dear patients if anything else can be offered for them beside if the combination therapy that we're all talking about here is not working. Of course, we're still optimistic and we are hopeful that everybody will benefit from therapy. Like any other therapy, understandably, will have potential side effects. These are the most common, even though they may be serious. We are obligated to make sure that we spell out everything. But as you can see, because between diarrhea, the fatigue, the nausea, the fever, the level of the blood count, the coughing, decreased appetite, abdominal pain, and probably some changes in regard to some of the liver function or weight loss can occur. This is in regard to the anti-CTLA-4 or the AGEN1181. And for the Balstilimab, for the anti-PD-1, same thing happened, common and maybe serious. Could be fatigue, nausea, diarrhea, some anemia as well, decreased appetite, abdominal pain, vomiting, some tiredness, fatigue, constipation, back pain, possible urinary tract infection, and fever. All in all, I would say that from experience, they will be generally well tolerated, but to be fair, we are making sure that we spell out everything, and you'll be having an opportunity to look at all potential side effects. In regard to the inclusion and exclusion criteria, please remember that the standard ones that we expect are going to be there. But most importantly, if you happen to have had prior anti-PD-1 therapy, it's no problem. Even if you had prior anti-CTLA-4 therapy, I doubt it, but nonetheless, in case, we will talk to the sponsor and we'll work on an exception for that purpose if it's applicable. At the moment, the study is only open for age 18 and above. However, we have a continued discussion with the sponsor, and we're working on ensuring that we bring the age all the way to 12. I'm sure you have plenty of more questions. Please take a picture of the QR code. The one to the left is the one of the clinicaltrials.gov, and proudly, we have fibrolamellar carcinoma now stated specifically on the website of clinicaltrials.gov, and you will see also all the sites that have this study open at them. They are really all over the country in the US, and you can, of course, reach out to any of them and connect with them or be on the study there. On the other hand, if you would like to reach out to us, the QR code to the right is for Sloan Kettering. Same study, no difference at all. But if you really are not sure whom to call or where to refer to anywhere in the country, or you want to come to us, we're more than welcome to see you, and we'll be happy to help you. Again, I thank you very much for listening. You have a great day.